Not getting enough sleep may raise hypertension risk, especially for females. According to a study due to be presented at the American College of Cardiology's annual scientific session, which is being held in Atlanta from April 6 to 8, 2024, sleeping fewer than 7 hours is linked to being at greater risk for high blood pressure. The researchers also found that the risk was even higher for people who slept fewer than 5 hours. The principal investigator on the study, Kaveh Hosseini, further noted in a press release that the risk of hypertension was greater for females than males. However, they were not certain whether this would actually make a difference in how patients are treated. How sleep duration is related to high blood pressure risk. An association between sleep patterns and high blood pressure has previously been observed, according to the study authors. To further elucidate this relationship, they pulled data from 16 studies done between January 2000 and May 2023. These studies included over 1 million people from 6 countries who had no history of high blood pressure. People were followed up on average for 5 years, although the follow-up periods ranged from 2.4 to 18 years. After adjusting for other factors that can influence the risk of developing high blood pressure, such as smoking, BMI, body mass index, and age, a short sleep duration of less than 7 hours was associated with a 7% higher risk of developing the condition. Additionally, sleeping fewer than 5 hours strengthened this link, increasing the risk by 11%. While the scientists did see an association between sleeping longer and high blood pressure, they did not find this to be statistically significant, meaning that it could simply have occurred by chance. They also did not find any differences based on age. However, they did find that females who slept fewer than 7 hours had a 7% greater risk than males. The study authors did note that the study has several limitations, including the fact that sleep duration was self-reported, so it was not possible to see how sleep duration changed throughout the follow-up. There were also variations in how short sleep duration was defined in various studies, with some saying fewer than 5 hours and some saying fewer than 6. Why not getting enough sleep might contribute to high blood pressure. Hubenik Takerbashev, MD, Health and Wellness Advisor at NAO, who was not involved in the study, pointed to 3 ways in which sleep can potentially impact blood pressure: sympathetic nervous system activation, hormonal imbalance, and inflammation. When we don't get enough sleep, our body perceives it as a stressor, triggering an increase in the activity of the sympathetic nervous system, he said. This system is responsible for the fight or flight response, and its activation leads to the release of stress hormones like adrenaline and cortisol. According to Takerbashev, these hormones can increase heart rate and tighten blood vessels. This creates greater resistance to blood flow and raises blood pressure. Inadequate sleep can also create hormonal imbalance, he explained. Renin and aldosterone, the hormones that help regulate fluid and electrolyte balance, can become dysregulated, causing sodium to rise. This additional sodium leads to fluid retention, which can contribute to elevated blood pressure. Additionally, leptin, which regulates appetite and energy, is disrupted, leading to cravings and weight gain changes, explained Takerbashev. Weight gain is linked to high blood pressure. Finally, chronic sleep deprivation is associated with increased inflammation. According to Takerbashev, chronic inflammation damages the endothelial lining of blood vessels, making them vulnerable to plaque accumulation. This leads to narrower arteries, which can restrict blood flow, causing blood pressure to rise. Inflammation can also affect kidney function, which is critical in regulating blood pressure. In order to get plenty of sleep, you should see a doctor to rule out any sleep disorders that might be affecting your ability to sleep. Once you've ruled out sleep disorders, practicing good sleep hygiene is the best way to make sure you are getting enough sleep.